Today, we are going to be talking about weakness of the gluteus medius muscle. One way to identify this weakness is through manual muscle testing. You'll have your client or patient lay on their side and abduct their leg against resistance. If they are unable to do so, or even just to do it without resistance as I am doing so now in more severe cases, you will be able to tell that they have weakness of the gluteus medius muscle. Another way to identify this problem is through dynamic posture analysis. People with weakness of the gluteus medius will have a hip drop when they're walking or even sometimes when they're standing. If the right gluteus medius is weak, it will cause the left side of the hip to drop. And you will notice that when they're standing on the right leg, it'll drop down, and you'll be able to tell through that. Weakness of the gluteus medius can cause a whole host of problems. Some of the more common problems associated with are medial knee pain and lateral knee pain. These are caused by body positioning and also by the fact that the gluteus medius is connected to the iliotibial band, which is a band of soft tissue that runs down the side of your leg and connects at the lower part of the knee. It can also cause low back pain, and this is from compensation. When someone has a hip drop caused from the gluteus medius weakness, the quadratus lumborum is often a muscle used to compensate so that your body stays straight. As you can see, when the hip drops, I have to shift my body posture over so that my head is naturally straight. The first step for correcting weakness of the gluteus medius is to inhibit the antagonist muscles. The primary antagonist to the gluteus medius is your adductor complex. This includes the muscles of the pectineus, the adductor magnus, longus imprevis, and the gracilis. Now, all of those muscles are located on the inside of the leg. So we're going to use self-myofascial release. This is a foam roller, and you can use this to inhibit the adductor complex like so. And you just roll out for sets of 30 seconds, probably 2 or 3. Or you can use a handheld self-myofascial release device, which is a lot more convenient for these muscles since they're in such an awkward spot. And you can use this to roll it out in the same manner. After you have inhibited these muscles, the next step is to lengthen the same muscles. In order to lengthen the adductor complex, there are a couple common stretches that work very well. One of them is known as a butterfly stretch. It's very simple. You just put your feet together, bring them in, bring your knees down while leaning forward, and you can use that to stretch the short adductor muscles. A nice way to stretch the longer adductor muscles is through just a nice side lunge. Get deep into it. Try to keep your chest reasonably up and straight, and you can just feel that stretch right along here. And then you go to the other side. And yeah, that's how you lengthen those muscles. After you have successfully both inhibited and lengthened the antagonist muscles, the next step in correcting this problem is to strengthen the underactive muscles, which in this case is the gluteus medius. The gluteus medius abducts the leg at the hip. So a great way to isolate the gluteus medius and to really work it is through leg abduction exercises. I am using resistance band for this one. You could also use a cable, or if you have like ankle weights. And you just feel that stretch. Yeah. Another great way is you can lay down on the ground and abduct. So you can just bring that leg up and you'll feel it right on the side of your hip, right where the gluteus medius is. And we're good. After you have sufficiently strengthened your weak gluteus medius muscles, the next step is to train them to integrate themselves with the movement of the rest of your body. A great integration exercise for this could be side-to-side lunges with a resistance band. And if you really want to feel a burn, keep sitting and just do crab walks. And you'll really teach those muscles to work together. You have to tighten your core, and you have to use other muscles to stabilize while your glute meats do most of the work.